Let me talk a bit about leadership and decision-making and sort of unpack some of that, because I think that's the theme of your event here. First thing I wanted to say, in talking about decision-making, of course, when you're the leader, of course, decision-making is important, but actually you need to get other people to make decisions. And I have seen many people failing because they draw all the decisions up to the top. And actually, if you think about it, when you're operating at this level and you get promoted up to this level, people still ask you to make the decisions you were making at the level one down, and you're comfortable to do it because it's in your comfort zone. But actually, when you're up at the next level up, you should be doing only the stuff that you need to be doing. And therefore, it's quite clear that, you know, that for leaders, and particularly very big organisations, actually you don't actually make terribly many decisions. You know? My job as leader was to make sure we set a direction, was to appoint the right people and give them space to carry on, and then, of course, to challenge them. But, you know, you're not the you may be the leader, but you're not the brightest person in the organisation. You certainly don't know everything else that's going on. And if you're running the health service, what do I know about mental health? You know? And actually, I need people to be thinking and making those decisions. And I need a method of making sure that I'm confident that those are as good a decisions as being made. So decision-making is quite an interesting art when you're at that senior level. They are in some other places. You've got to take people with me. So on the one example, I had these clinicians leading the way, and wanting to make the change happen, and I had to provide air cover. And on this other one, I had to make the decisions and push it, and I wasn't opposed. And that was a really interesting point. And they're two very different sorts of decisions, but they're both the sort of decisions that I guess quite a lot of people in managerial jobs where you've got many stakeholders and many powerful people have to make it work. There are decisions where I had to go along with, which I didn't think were necessarily the right ones, but you'd make a trade-off, you know? You're not convinced this is the right way to go, but actually you probably have to do it. Mm-hmm. There were decisions I made where I had to persuade the politicians to be with me, and there were decisions where we made jointly, and where, in a sense, I think we had to create a sort of framework for making those decisions. Because in that complicated situation, you've got masses of stakeholders, you've got and all the powerful ones have access to the Prime Minister, you know? We took 8.5% out of the pharmacy budget, out of the pharmaceutical companies' prices. I hired an American and set him off to take on the drug companies, and he took out 8.5% of the budget, and the pharma companies came and complained to the Prime Minister, so we had to reduce it to 7.5%. Interesting, you know, you've got that sort of circle. The senior doctors treat the Prime Minister, if you like, you know. I mean, doctors have this privileged access to power, so you've got a lot of stakeholders that you're looking at. Yep. And one of them was actually changing the consultant contract, which was quite interesting. There's been a row in the UK about how consultants work in the NHS, and that they needed to be paid in a different way, because actually consultants working in the NHS were also allowed to do private practice. And the Labour Party, coming from their particular political spectrum, wanted to sort that out because they thought that a number of people cheated on that arrangement. Now, if I were trying to reform the NHS, the first thing I wouldn't have done was pick a fight with the doctors. No? It wouldn't have been on my strategic route. You know, I might have picked one a little bit further down the line, but I think I'd have got a bit more on my under the belt. But they didn't really have an option because, you know, this is what the Labour Party wanted. You know, they wanted people working in the NHS to concentrate on the NHS. So I had to sort of decide, I guess, that I could go along with that, and I had to take the party line, and that actually it may not have been the route I was on, but actually let's see how we can work with that. And it wasn't my decision at all. But we had to try and get the best result out of it. The other sort of stuff that I needed to do, which were my decisions, were about how you organise the management. Now, the Prime Minister didn't, or the politicians didn't necessarily agree with the way in which I chose to do it, but those were the stuff that I had to persuade them that it wasn't daft, that I was making sure that, you know, we had nurses in particular positions or whatever. So we had those trade-offs. But I think the most interesting position is that we had to find ways to make strategic decisions that were robust and good.
A decision is not a moment in time, is it? It is a process of understanding and learning, or being told what the dynamics are. Yeah. And there is a decision that is placed before you, which you may need to reshape or not. And then it is a long process of how you go about implementing it, modifying it, evaluating it, actually defending it in ways that will allow for sustainability of a process to take its time. And this is I think, when we talk about leadership, we don't often use the word stamina or constancy of purpose, but there is an aspect of being a leader which has a component of indefatigability. You have to be there for quite a long haul. I can feel it in how you're talking.
You alluded to the importance of the people that you surround yourself with when implementing a lot of these initiatives and change. And so my question is really, when you get into a position or a new job, how do you think through the process of selecting your team, especially when you are tasked with really changing the culture and the dynamic of the organization?
It's a great question. And I'm going to pick it up in two ways. I mean, the first one is you arrive and there's people in post. You know, it's not only organisation, so there's people in post. So you have to make some judgments about people in post, and you have to also work out. I think I said earlier that you've got to work out what only you can do. You know, what are the bits that only you can do? What are the decisions that only you can do? And then make sure that you've got people around you who can do some of the rest. I have a sort of shape of mind that is fairly strategic and big picture. I needed a guy, and tell you his name, John Bacon, who was focused, detailed, and he and I made a fantastic dual act. In that, you know, I would do the big picture and John would get fed up with me doing the big picture. He'd say, let's get down to detail, you know? And I'd say, John, let's do that, and then let's make sure that it's fitting to the bigger pattern. So, you know, there is a bit here about a team dynamic. Let me widen that out a bit, because something I didn't mention earlier is something which I call a coalition of leadership. You're all going to be engaged, or already engaged, in organisations where power isn't in one place. It's with the politicians, it's with the doctors, it's with the staff organisations, it's with the patients, perhaps, hopefully one day. It's with a whole range of people. So how do you create a coalition around you, not just the people you employ? And we've very carefully tried to bring people into contact and discussion with us. And I say we because it's not just a single person's job. So that we actually had around the top table enough people who could represent slightly different perspectives and so on. And actually, during the successful years for our change, which was between 2002 and 2005, there was at the top of the NHS 9 people who were what I regarded as the leadership coalition. It was the Prime Minister, and it was me. It was the Secretary of State, the Minister. It was their advisors, and it was my 2 people. And I had 2. I had a left hand and a right hand. I had John Bacon, who was the guy who was the tough detail guy. And I also had on the other side of me, I had a very developmental guy. Somebody who used, those of you know, with the Institute for Healthcare Improvement here, used IHI methodologies for about improvement. It was two-handed. Tough holding to account, developmental. And those 2 pulled together. And the 9 of us stayed in post for those 3 years. And that's another important point, actually. You can't keep chopping and changing. 3 years isn't very long. But while those 9 were in place, we knew how to make decisions between us. It had sort of evolved. And then along came an election, and the Prime Minister, in his wisdom, changed all the politicians. So in the end, there was him, me, and another couple, and all the politicians in between had changed. And then the Prime Minister went the following year. You know, but that was an interesting example of political decision making. Wouldn't have been what I would have done. You know, if this was working, I would have maintained some continuity. But that notion of a leadership community, I think, is really quite a leadership coalition, and it is a coalition. You're not all on the same side. You're absolutely right. The most important thing you can get is feedback. So you learn how to handle what you've got, which is you, and it's very hard as a leader. Nobody tells you the truth. More senior you get, less people tell you the truth. I'm sure you all tell the Dean the truth, but but they either try and bullshit you, if I can put it like that, and sell you something, or they tell you you're doing an awful job and attack you, you know. So you've got to find people around you to tell you the truth. But it's absolutely right. And the other side of that is that the hardest decision that you ever make is to sack a friend. You know, if we go back to the decision-making theme, I remember one person whom I ended up having to move on, who was good. He was good, really good. He was a great guy, but he wasn't good enough, in my judgment. I think I was right, but it was a really difficult decision. And it's those personnel decisions which are actually the ones that hurt and are hardest and stay with you more than some of the others, in my experience. Well, it's been both terrific and hard. You mentioned somewhere about the need for grit and determination and stamina, because it doesn't work first time, it doesn't work fourth time. You know, you're making improvement one patient at a time. You know, when we were bringing down the waiting lists, my chief executives knew that I wanted them to know which patients had been waiting longer and why they had been waiting longer. You know, there's a bit of detail here which is actually really rather important. And you can be in these brilliant academic centres and you can design stuff that sounds wonderful. But actually when it hits reality, there's a big thing about just continuing, about stubbornness, about and about the biggest problem for chief executives, which is lack of self-confidence. You may not appreciate that, but any number of chief executives I've talked to have had crises of confidence, because you're the only one. And actually you don't have to be a chief executive of a socking big organisation to feel that. You just need to be a leader of a team that actually sometimes... and one of the things that I have learned and been very grateful for is to ask for help when I need it. Yeah? Really important. When I was running the NHS, I had 600 organisations accounting to me, 600 chief execs. And I could see the ones that failed. The ones that failed is when things started to go wrong, they went into siege mentality. You know, they hid in their office and they tried to think their way out of the box. The ones who succeeded, because everyone's got problems, because you can bet that there will be problems to pick up. The people who succeeded were very often the ones who, when faced with that problem, found somebody to work it through with. You know? And I don't mean a buddy, I actually mean they went and found somebody who'd solved that problem. They said, actually, I don't know what the answer is, let's see if we can find it. And I think that's a very big thing which actually keeps you vibrant and alive. If my final word is that I say in the book that I had this awful week which started on Monday in Whitehall, and the first thing I did on Monday morning was meet with my Secretary of State so that we could talk about what each other were doing during the week. And then I spent 3 or 4 days in Whitehall and dealing with the sort of grind of politics, but policy making and you know, having to pay attention to what the media was doing and all that. And on Fridays, I used to walk around the NHS. I think 30 times a year is probably what I managed out of 52 Fridays, is I'd get out into a hospital, I'd get out into primary care, I'd go around, I'd remember why I was there, and I'd get refreshed from that. And if you're a leader, you need to get that refreshing and that connection back down to what it's about. And people challenge you. But actually the really sad thing was that people said, thank you for coming. You know, people will recognise that. You know, you come along and you ask people what they're doing, and they tell you, and so on, and you think, you know, we're trying to make this thing better, and I know that part of the time it's making it harder for people as we make these changes, and they say, thank you for coming and talking to us. And it's a really humbling bit, but it's also, for me, it was my therapy. Frankly, you know, it was what kept me going. And so I think there is a big bit, you know, there'll be different sorts of leaders. There'll be different people who do it in different ways. But I think for many people, making sure that you don't think leadership is a one-person job, making sure that you're constantly learning and you're not going into a shutdown mode, seems to me to be very important.
You know, when we're